Now onto our presentation. I would like to welcome Colette Katuala. For over 2 decades, Colette has been a public child welfare professional with experiences as an emergency response investigator and as a supervisor. She has supported child abuse investigations and supported staff working in court units. She has provided coaching and training to new and ongoing child welfare staff and currently serves as a coordinator of the Bay Area County's Child Abuse Prevention Council. In addition to her public service career, Colette opened and currently operates Focus Clinical Solutions, which is a small private practice that supports the community's pursuit of improved emotional health. She writes curriculum and trains on various topics impacting children and the well-being of their community. I want to welcome back Colette. We're very excited to have you here today, and especially with this new 3-part series that we're kicking off today. So welcome, Colette.
Thank you so much. Thank you for having me, and thank you for everyone for being here today. We will be going through the training throughout the whole, from now until noon. So feel free to take some time, step away, step back, and hopefully participate as much as you would like to today. So the first part of our training will be covering the overview, a brief overview of the child abuse definitions, just really to ground ourselves in the work that we're doing today. I'll talk to you about some of the updated laws around general neglect. And the second part of our training, the second hour, will really be focusing on applying the role of community supporter, really talking about what is reasonable suspicion, how do we determine reasonable suspicion, and all of the things that we do before we reach reasonable suspicion. So I would just like to maybe in the chat, you can introduce yourselves, your name and your role. And if there's something that you would like to get out of today's training, just so that I can be aware and hopefully answer those questions. As I train today, if questions come up, as questions come up, please either unmute yourselves, ask a question in the chat, or raise your hand so that we can hear you. And yeah, just I hope this training is very near and dear to me as a child welfare professional. I've worked with mandated reporters throughout my career, and to really, this is a really good opportunity to support you all in your work with families. So here we go. So federal definition of child abuse and neglect. It's a very broad definition. I'm sure we're all mandated. Just looking at the chat, where a lot of us are mandated reporters working in various aspects, whether it's within the community or organizations, governmental officials or otherwise. And so we've probably all heard at some point in our careers what the definition of child abuse and neglect is, what the federal definition of child abuse and neglect. So in terms of CAPTA, which is the Federal Child Abuse Prevention and Treatment Act, it says that child abuse and neglect is any recent act or failure to act on the part of a parent or a caretaker, which results in the death, serious or physical harm, or sexual abuse or exploitation. Or when we're talking about general neglect, it's an act or failure to act which presents an imminent risk of harm. Now, as we're talking and looking specifically at the federal definition of child abuse and neglect, some of the things that that kind of are striking is the word recent act. Now, a lot of times when we are working with children and their families, and we receive information, we may or may not know the time frame of that. And so it's really important to understand recent, and it's not defined in the penal codes. It's not really specified clearly. A lot of, unfortunately or fortunately, a lot of the child abuse laws are for us to determine depending on the work that we do with children. We may, when we're making reports, when we receive information, we may forget the word recent. That's part of the federal definitions. So when we're looking at recent, why did the federal government say that we needed to look at recent acts or failure to acts? Because in child welfare, as we're receiving reports, whether it's in child welfare or law enforcement, receiving reports of suspected child abuse and neglect, we are making, we are looking at point in time investigations. We're looking at investigations, or we're looking at situations with families that are occurring right in the moment or recently. Because our jobs as mandated reporters is to prevent child abuse and neglect. And for child welfare to intervene so that we can prevent further abuse or neglect. Another part of this federal definition that we need to look at is on the part of a parent or a caregiver. A lot of times when mandated reporters are making reports of suspected abuse and neglect, sometimes we're not concerned about the parent or the care provider or the caretaker. Sometimes there are situations where children or youth are hurt or injured, and it's not by the hands of their parents or guardians. Sometimes it's a school official. Sometimes it is another community member. So when we're calling and thinking about involving the child welfare system, it's really about recent acts or failure to acts on the part of a parent or a caregiver. So then you may ask, okay, so if a teacher or a coach or another adult in the community harms a child, is it not a suspected child abuse report? There are two areas that you can make suspected child abuse reports. And sometimes those suspected child abuse reports, suspected child abuse situations are criminal. Both law enforcement and child welfare can receive reports of child abuse and neglect. So why do we have these federal laws? Well, it was passed in 1980 because physicians in hospitals were seeing children who were having injuries, maybe repeated injuries, and they were not being reported. So originally the CAPTA legislation was passed for physicians specifically to report their suspicions of child abuse or neglect. As time went on, other child serving and family serving professions also became mandated reporters. And various amendments as child abuse and neglect became more aware in our community, then numerous laws were passed to expand those definitions to where they are today. The federal government also asked or required the states to set up reporting requirements and mechanisms for us to receive reports and then investigate those reports of abuse or neglect. Every time each state, so today we're really talking about state laws, California state laws, because each state in our country has different laws of how they say this is how we're going to integrate or operationalize this reporting requirement. Here in California, it's CANRA, or the Child Abuse and Neglect Reporting Act. Again, this is a brief review. CANRA has several things. It talks about what reasonable suspicion is, which we'll get into in the second half of our training today. It also sets up procedures, and it requires certain professionals to report abuse and neglect. Now, state laws currently are that the categories, the professionals are increasing, ever increasing. Here in California, we have over 40 different professionals that are required to report their suspected abuse and neglect of a child. Now, there are some people there in the legislation that are really looking at the our substantiation rates and the impact our reporting has on the child. And they are saying that maybe the list of required professionals is too long. Maybe not all of the people who are required to report should be mandated to report. There are some people who say that all adults should be mandated reporters because wherever there is an adult, a child should have an advocate in that adult. Here in California, we have reasonable suspicion, we have policies and procedures established, and we have this list of professionals that are required to report. Reasonable suspicion. Reasonable suspicion, as it's written today, is when a person who is legally mandated that has knowledge of or observes a child who, in their professional capacity or within their scope of their employment, knows that that child is a victim of child abuse and neglect. It goes on to say that reasonable suspicion occurs when it is objectively reasonable for a person to entertain such a suspicion based on facts that could cause a reasonable person in a like position, drawing on, when appropriate, their training and experience to suspect child abuse. Okay, that's a mouthful. And sometimes we're like, okay, so what does that really mean? Well, if we break it down, it says that it's someone who's a legally mandated reporter. So we have to fall within those 40 plus list of categories. That also includes volunteers who work in organizations around children. Those organizations are required to have their volunteers trained to go to someone who's a mandated reporter. It talks about within our scope of employment. So that means while we're working. So if we're not working on vacation, we're no longer in the role of a mandated reporter. We are a private citizen that absolutely has the ability to make a report, but they're not legally mandated. And then it goes on to say, for someone who has someone in a like position. Now, this is very important. Though I'm a child welfare professional, I am not in generally in a like profession, in a like position. Child welfare staff are required to receive information, make an assessment as to if we're to intervene or not. As a mandated reporter, our requirements are to talk to our fellow colleagues that are in a like position, that may be working in the same area that we're working on, and given that information with the knowledge of what is reportable or not, they would also agree that this child is that we would suspect child abuse. There are so many nuances to reasonable suspicion that I hope we'll be getting into today, that I hope that, as you're thinking and listening to the statistics and some background information on this, that you're also thinking about situations that you may have come across that or may not have been sure that this was reportable or not. Neglect allegation statistics. General neglect in California and across the country and right here in Alameda County is the most reported allegation across the board. So if you see here, the yellow stands for the general neglect allegations. The highest allegation from year over year from 2013 all the way through 2022 and even last year. So why is general neglect the most reported category? You can maybe write some of your thoughts in the chat about why you think general neglect is the most reported category over sexual abuse, physical abuse, where the laws first began. Yeah, it's pretty visible. Missing when we're talking about caretaker absence and incapacity. Some people say that they may not know the reasons for something being wrong. They just see that something is wrong. Maybe the nature of our work and programs. Yes, people are afraid to say about sexual abuse. Fear of reporting others and being wrong, yeah. When we're looking at removal statistics, when we're talking about, okay, so if we're saying that neglect is the most reported category, the most investigated category as well, let's look at how it impacts children, the removal. And if we're looking here, with neglect being the darkest blue, we see that the removal reason, the reason why children are removed from their homes and placed within the child welfare system, most of those removals are because of neglect. The next one would be physical abuse. And then you see a thinner one, that lighter blue is sexual abuse. So most of the children that are being removed from the home, from their homes, from their families, from their communities in most cases, are because of general neglect. So it has a huge impact on families, from removals, from investigations, because in terms of investigating children, wait, so there's a question. So the point is being validated as general neglect. So I'm talking about general neglect, and we'll see if it's validated. We'll see. I mean, some may assume that if there are high allegation referrals of general neglect, and that also is the most being removed, is it valid? That's a really good point. Let's look at these substantiations. Thank you, Deborah. I think we kind of just went right into the point that I was leading up to. In 2022, there were over 400,000 allegations. Out of those allegations, only 12% were substantiated. So let's think about this. 400,000, over 400,000 allegations. We saw all those numbers. Out of those, 12% were substantiated. Now, of those 12% that were substantiated, those numbers that we just saw in the previous slide said, well, how many of those 12%, out of those 12%, how many were neglect related, physical abuse related, sexual abuse related? And then when we start to drill down so we're like, okay, so if we have only 12% substantiated, that means that there's over 70% that are not substantiated, that don't meet the threshold of the federal definitions. So then there's more drilling down in terms of, well, who are making the reports? Who are the people or the categories of not all allegations were substantiated. Not all allegations were substantiated. So, or excuse me, not all allegations, yes, in this number, all of the allegations were investigated. Sometimes these allegations are dual. They have more than one allegation. One child could have more than one allegation. But yes, these are all investigations. And only 12% of those investigations were substantiated. Yes, it is triggering, and I would invite you to even say more as to like what's triggering you, because this is if we can imagine like how it's triggering to us as service providers, you know, I think about the impact and how it impacts the families. So when we're talking about the categories of substantiated reports by category of, and we're saying by categories of mandated reporters, because when you're calling to make a suspected child abuse report, we're asking you like, where are you calling from? Schools, law enforcement, hospitals. So out of this number of allegations, about 100,000 calls came from the world of education, like so schools, and you know all the people that work in the education system. Only 5% of those 100,000 calls were substantiated in 2002. Law enforcement made about 88,000, these are statewide, 88,000 calls to for suspected child abuse, and 26% of those calls were substantiated. And then counselors and therapists made up about 67,000, and they were only also substantiated 5%. Why do we see such broad and differing substantiation rates by category of mandated reporters. Why do you think? You can kind of put that in the chat as well. I was very curious, and when I saw, um, so of the calls, of the 100,000 calls by education, only 5% of those calls led to a substantiated investigation. There is one thing I didn't put on here were the two categories of mandated reporters that like had the highest rate of substantiation was law enforcement and hospitals. So when law enforcement and hospital staff called, they were very clear. It led more likely to substantiated reports. So here we are today talking about how can we make the criteria clear for reporting. And that's really our goal with the series is to find some clarity around this. Yes, not all allegations rise to the level of an investigation, and not all can be substantiated. Yes, that's correct. Further, the law, I'm reading a note, further, the law mandates a report of reasonable suspicion, not an investigation at the educational law enforcement or provider level. That's a really great point, Philip. So a couple of things. We will be talking about clarification versus reporting. And law enforcement actually does receive and investigate reports of child abuse and neglect. It is not, we are not having it is not a CPS report. It is a suspected child abuse report. And here in California, both law enforcement and child welfare can receive and investigate reports. And sometimes there's actually one of the nuances is who do I call to make a report? So let me help you with that. If you're calling law enforcement, if you're not worried about that parent or that guardian, then you should be calling law enforcement to make a suspected child abuse report. Because a lot of times the hotlines in California, across the country, across the state, across our county may receive reports from mandated reporters, and they're saying, I don't have any concerns about this parent or guardian. Well, guess what? Child welfare only does investigations that point to the parent or the guardian. So if you're not concerned about the parent or the guardian, then you're calling law enforcement to make a suspected child abuse report. It's a misnomer that it is a child abuse report. It is not a CPS report. It is a suspected child abuse report. Okay, general neglect. Y'all, I'm really very good. I'm very happy about the information in the chat. The information for mandated reporters, it is confidential. We're not law enforcement and child welfare are unable to provide that information, are required to keep that information confidential, except when we're reporting to, when we're having to talk to a judge or when we're doing cross-reporting or record keeping. A lot of parents, we do have the third part of our series is we'll be talking about what happens after a report is made and how to work with families. So more to come on that. General neglect. There have been some updates to the general neglect laws. And before 2023, general neglect is defined as the negligent failure of a person having care or custody of a child to provide adequate food, clothing, shelter, medical care, or supervision where no physical injury has occurred. Now, I'm speaking specifically on general neglect for several reasons. That's where we see the most updated laws, and this is where it's reported the most. This is also where children are removed the most. And this also has one of the lowest substantiation rates in general neglect. Most counties when they receive reports of general neglect, they maybe go out about on half of them. About half of the calls actually qualify for an investigation. There are situations where I see there's comments in the chat about like how parents may figure out and if a person tells only one person something and then a child welfare investigator shows up, they do ask. Sometimes I've heard they've asked, like, did you make a report? And so the third part in the training will be talking about, like, how do we navigate these relationships, because it does happen. So in general neglect prior to 2023, this was how general neglect was defined. Well, AB 2085 or Assembly Bill 2085 was signed into law by Governor Gavin Newsom in September of 2022, updating the definitions of general neglect. It says, it updated to say that general neglect means negligent failure of a person having care or custody of a child to provide adequate food, clothing, shelter, medical care, or supervision where there is no physical injury to the child has occurred, but the child is at substantial risk of suffering serious physical harm or illness. So it's when a parent or person has negligent having care or custody of her child to provide adequate food, clothing, or shelter or supervision where there is no physical injury, but the child is at substantial risk of suffering physical and serious illness. And big caveat here, it says general neglect does not include a parent's economic disadvantage. If we're thinking about all of the times that we have come across a child that we were worried about, and we asked ourselves about their parents' economic disadvantage. And if we said, does this parent have financial difficulties, lack of resources? Now it's no longer a suspected child abuse report. So what does this mean? In so many areas, it talks about when we're looking at general neglect, when we're looking at these numbers here, We're really talking about the impact of neglect investigations has on families. Child abuse investigations not only do safety assessments structured by using something called structured decision making, but they also do something called risk assessments, where they you also using a structured tool. They by asking a certain levels of questions, they ask they ask specifically about certain risk factors with families, and some of those risk factors could include a family having previous child welfare investigation, a parent having mental health issues or substance abuse issues, or being abused as a child, being a former foster youth. And so when I'm thinking, when I ask about these numbers and I ask colleagues about, well, if we have such a low substantiation rate, how come the removals are so high for general neglect? If substantiation rates are low, then why are all these children being removed? And I discovered, I was told that, well, because sometimes if investigations lead to an inconclusive or maybe even unfounded, a lot of times inconclusive, meaning an inconclusive, just to give you a tidbit of next training on the 23rd, inconclusive is when that there is some information to say that it happened, but not enough to to have reasonable to have like a removal, possibly to say that abuse or neglect happened. Thank you, Deborah. So what does this mean? This means that children are also being removed when there is no substantiation, but maybe very high risk. Maybe there are some concerns, some long-standing concerns, some chronic concerns that generally point to neglect that lead to removal. Well, the federal government is making some changes. So not only are they saying that general neglect now does not include a parent's economic disadvantage, it's also saying that the state, child welfare agencies, and departments can no longer remove children because of that parent's economic disadvantage. So they cannot remove children because of poverty. And I know a lot of us, even as I'm doing various trainings, a lot of us may have thought that poverty and neglect are synonymous, but they're not. Poverty and neglect are not synonymous. Poverty can be a risk factor of neglect. Parents and families who are under-resourced are more likely to be stressed out about housing, paying bills, and higher parental stress is a risk factor for abuse and neglect. When we're talking about, there were these conversations about, well, if we, as we make a report, we'll tell a family, they know about it, they come back to us. I wonder what these situations are, and we're worried about like how, our place and our well-being. And I think about the families. I think about over surveillance. Like one of the comments said was like, neglect is quite visible. I don't know if neglect is visible versus poverty. Poverty may be a lot more visible. But when we're looking at general neglect definition, we're looking at the word negligent. negligent failure. A lot of times, most times, poverty is not negligent. When we're looking at situations and we're looking at concerns with families, maybe one of the things that we can ask based on this definition is, can money fix it? There are a lot of things that money cannot fix in the world of child abuse and neglect. Cannot fix sexual abuse, cannot fix physical abuse, it cannot fix emotional abuse or the impacts of domestic violence or intimate partner violence. But if we can look at a situation and we can say, can money solve this problem? Can a resource calm my worry? Then we know that it's not general neglect. And it's our requirement, our duty as mandated reporters to support that family. I would like for y'all to just reflect for a moment and maybe remember and think about why you are in the profession you're in. And maybe put it in the chat, like, why are we here? Why do we choose this profession? Why do we choose to do what we do? I know for me specifically, someone asked me recently, why do you, after 20 something years in child welfare, why are you still doing this work? And community, my community, family, and really supporting mandated reporters and others who work with children and their families. When I talk to people about making a mandated report or possibly making a report, a lot of times the first thing that they tell me is they tell me how the report made them feel. The first thing that they say is they say that I felt compelled to make a report because maybe no one helped me when I needed help as a child, or maybe when I did need help as a child, someone helped me. Or maybe I was raised like this, or I wasn't raised like this. A lot of times we're making reports based on our feelings and not on the impact to the child. We do need to remember when we're asking ourselves, when we receive a report or receive information about how it makes us feel, are we making a report based on that? Or are we making a report based on the information provided us in our trainings about suspected abuse and neglect? What is your implicit bias? What are your biases? And I'm hoping everyone in this room, everyone in this training can identify what their biases are. Because if we say that we don't have biases, we're not really honoring and respecting truth. We all have values. We all have our belief systems. And a lot of times what we're missing when we're making a report is an awareness of that. it is very important to understand, like, what are my biases? When a certain person walks next to me or by me, how do I feel or respond? It absolutely has an impact on reporting. Exactly. It's things are triggering. And so and that also coming from certain backgrounds could either elevate your propensity to report or decrease it. Some people could also be like, I've been in this situation before and I made it out okay, so they'll be okay. Or we may have an idea of what neglect looks like. And if neglect looks like poverty, if we believe that neglect looks like poverty, then we're reporting on a lot of poor families. Then we are impacting that number. Child welfare does not save children from poverty. Child welfare is doing a lot of things in their own area to clean up, the things that they need to clean up in terms of removing children from poverty-stricken areas, which is why that law passed for child welfare as well as mandated reporters. There in no situations can we no longer say that a poor family has neglected children. Another thing that we need to look out for is something called gaze aversion. Now, there are situations of underreporting. I know you would think, like, Colette, like, you're here talking about, like, not to report so much. Well, we need to report responsibly and across the board respectfully. If we're looking at demographics of income levels, if we're looking at demographics of racial ethnicities, there are situations where certain categories are overreported: Black and brown children, Native children, poor families, versus who is underreported: white families, Asian families, families in higher socioeconomic situations that are not in poverty. So why is the case when research says that abuse happens across the board, whether they're in rich families or poor families, white families, Black families or Asian families, Chinese families, Japanese families? So we have an idea in our heads, back to implicit bias, gaze aversion, who are abused and neglected children. I have the benefit of speaking and going to talk to people in a lot of different communities. One of the community in various communities. And in these communities, there is abuse and neglect all over, and we need to be um, um, cautious about children who are quiet, children who may not be outwardly expressive. And I do just want to pause and say that I know that this topic may be is thought-provoking, feeling-provoking, and if we can just all be mindful and respectful as we communicate with each other. and it's true, like there are a lot of biases towards single fathers. Um, and and we need to really think about that. And this absolutely impacts how we engage with people. We may have a certain idea, picture of what an abused or neglected child is, but when I'm talking with some people in Pleasanton, we've been really working together with them, and abuse happens there. And in my practice as a psychotherapist, I work with a lot of adults who were not raised in poverty. And they talk about the abuse or neglect that was inflicted upon them, and no one paid attention because, well, they came from a good family. They lived in a nice neighborhood, or they may be from various Asian cultures that are that from what I've been told, have been said that we will not say that we've been abused or neglected as a child to a parent or to a teacher. So there are so gaze aversion. It's not just like, yes, we may not be able to see neglect, but we can see poverty. But what about all the other categories? Who are the abused and neglected children? Like when you think about that, when you think of an abused or neglected child, what comes to mind? Clarifying, not investigating. So this comes up, well, this is one of the bulks of it. A lot of times people are well, even here in the chat, it's like, we shouldn't be investigating. I was trained that I shouldn't investigate. However, we do need to establish reasonable suspicion. And some of the things that came up was gray areas. Not sure if a report if a report should be made. When I hear situations about gray areas, one of the things that comes to mind is you probably don't have enough information. When we have gray areas, that means we need more clarity. That means we need to ask another question. Now, once we have enough clarity, then, okay, then we need to stop our investigate. Then we need to stop our questioning. That's when an investigation starts, is once we have, oh yes, this is reasonable suspicion. And when we continue and we cross that threshold, then we're into investigating. But if I hear a gray area, that means that we need to ask some clarifying questions. Impact to the child. Sometimes we've been trained to, as mandated reporters, and if we add up all of the years of experience we have in the room today, I'm sure we're well over hundreds of years of experience in this room. And when we're thinking about clarifying and not investigating, we need to ask ourselves, what is the impact to the child? We're not just talking about parental behavior. Yes, parental behavior can be unnerving, disturbing, triggering to us. It may not be in alignment with our values, with our belief systems, how a child should be raised or dealt with even. We have to first check ourselves. How does this report make us feel? We need to look at that parental behavior and ask ourselves, what impact does it have on the child? We're also asking, does this family need resources? Is this a resource issue? If this is a resource issue, then it's not a suspected child abuse or neglect report. General neglect is not poverty. Poverty is not general neglect. Ask yourselves, can money fix this issue? Now, I know there's a lot of questions like, okay, so I need to find resources for family. Yes, we're all social workers now. I know we have a lot of different providers in the room, supporters of families in the room. This absolutely means with the new law changes that if we're looking at a family and we're saying this family, they need something, let me call CPS. No, we need to we have a big group in this room. What resources are needed for families? Can money fix this issue? Sometimes it just takes asking one more question. There is a situation where this family, newcomer family, was staying in an apartment. The home visitor came to the apartment. They saw that they were sharing one room. It was small. There was some mold on the walls. The stove was not working properly. There was some hookups to the refrigerator, you know, with a wire going out the window to a neighbor. So they were using all kinds of hookups. There was no running water. The family visitor came in, was talking to the parent, and given the situation, and it looked really unsafe for the children, the visitor decided to make a suspected child abuse report. The investigator goes out and talks to the parent, and come to find out that the person, the parent who's renting the space, has been going back and forth with their landlord, that the landlord was supposed to be taking care of this and taking care of that, and that they were not able to get the landlord to take care of the needed things in the home. That home visitor could have asked one more question. Could have asked that parent, have you talked to the landlord? Have you reached out for any support? Do you need some advocacy for this slumlord? Most of the time, a lot of the times, it's about clarification and not investigating. I have some other clarifying, not investigating things, and maybe we can kind of talk about these to see, are these reportable? Do we feel like this is something that's reportable? What information is possibly needed to make a report? So the first one says, a student teacher reported that a 4-year-old said, "My mom punched me in the face. There were no visible marks or injuries. It was not asked when this occurred or anything else. How can we get what are some clarifying questions we can ask that may not lead to an investigation? These are these are real reports, by the way. Real reports to the hotline. What were you, what was, or what were you both doing when it happened? So Emily, for the landlord example, thank you for asking that. No, because making a suspected child abuse report would be that a parent or a caregiver is doing something willful that is harming that child. That was a good question. What were you both doing when it happened? Were you playing with your mom? Was it by accident? Were you playing, wrestling, or fighting? All of these are really good questions. Yeah, like, and maybe not like, were you playing wrestling or fighting? Maybe like, what was going on? What was happening? Maybe even asking what happened next. When, asking when, because we're talking about recent. I mean, if we're thinking about like a 4-year-old who says that their mom punched them in the face, you know, not to, I would, I would be asking, okay, if there's any marks or bruises, because when I would be thinking like, um, what are the indicators of physical abuse? Some of the indicators of physical abuse is an injury or a substantial risk of injury. I wonder how we would talk to the mom. A lot of times we're talking about lack of engagement, resources, supports. We do need to ask if we don't have enough information for reasonable suspicion, then we have not reached our mandate of reasonable suspicion. If we don't have enough, then reasonable suspicion has yet to be made. So we may need to go back and ask a couple of clarifying questions to determine, has reasonable suspicion been established? Let's look at the next one. A school counselor reported that a teacher attempted to take a phone away from a 15-year-old in class. The student refused, and the teacher grabbed their hoodie in an attempt to remove them from the classroom. How can we clarify? Is this a mandated report? What jumps out at you with this particular scenario? This was also a suspected report to the hotline. They got grabbed. Yep, it's not a parent caregiver, that's correct. It's also to be noted in here that I didn't add is that the parent is aware of this and they made a police report. there is a very big impact when we call and make a suspected child abuse report. As of right now, the information, that call stays on that family's record forever, for life. Whether we investigate, whether it's substantiated or unsubstantiated, whether it's whether we're concerned about the parent or not. Every call that is received by this by child welfare is listed, documented under the mother's name. So even if the father was the concern, even if the mother had passed away and is no longer alive, then there would then that report is still under the mother's name. And that it creates history for that family. If there's an issue with a child being injured and it's not the parent or the caregiver, then you're making that suspected child abuse report to the local law enforcement agencies. One clarification is to decide who should we be calling. California receives reports from law enforcement and child welfare, and we cross-report. Who has access to that history of reporting? All county child welfare departments across the state have access to this history. So if a family is here in Alameda and they move to Contra Costa, then to Fresno, then to San Benito, then to Los Angeles County, they will see all of that history. All of the history. There are some pushes to get rid of some of the history, to delete history that's not substantiated. Not any job that, most jobs that have to do with children, yes, are mandated reporters. Ruth, that's a good question. Question is, why is it always associated with the mother? I've never gotten a definitive answer to that question. However, we can speculate a couple of things, that it's easier to determine maternity than paternity. It shows a history of elevating mothers and decreasing the status of fathers, which historically has been done in child welfare and other family like court systems. But yeah, it is something that we don't have the specific reasons to. I think that's the reason. Yeah, it really sets up a bad precedence, because what if that mother is non-custodial, or what if the concern that we're worried about is not the mother, or maybe the father or another parent? You know, when I talk to people, right, and household members can absolutely change over time. And so as we're thinking about all of these things, we need to be very cognizant of when we think that, oh, we're going to report just in case, better to be safe than sorry. We cannot continue as mandated reporters and believe that reporting is a harmless act. Reporting is not a harmless act. It does have reverberating impacts, a lot of times negative impacts on children and their families. So just kind of looking in the chat, Deborah's asking about like some jobs that one has to do fingerprintings for reports. So we'll talk about that in the second part of the training. There is a database that keeps information of reports, substantiated reports. And that's for fingerprinting, and that goes to the statewide Department of Justice. But those are only on substantiated reports. And Philip is talking about saying that the history is a mixed bag. On one hand, the history is damning, and on the other, with abuse that is covert or not obvious and ongoing, the history is helpful to assist that child and that family. So I have no easy response. Philip goes on to say regarding the mother, yes, even the court procedures focused almost exclusively on the bio mother. And yeah, so we definitely in child welfare use history as a way to receive information. We do need to be careful though about over surveillance, because there are only certain zip codes that child welfare in Alameda County anyway goes out on a lot. There are some zip codes that they don't go out on very much, when we know that abuse happens across the board in all zip codes. All right, so thirdly, children 7 and 9 have only been to school 67% of the time. They do not attend because their mother doesn't send them. They are well dressed and groomed when they attend school. What are some things that we can clarify, get some clarity on in regards to this? What's missing? Right. Does the mom have transportation? That's great. I would even ask, is this a suspected child abuse report? Yeah, what's going on in the home? What's getting in the way? What are the barriers? Does the mom value the education system? Is the mom sick? Yeah, the mom's health, what's going on in the home? So even here when we have, so all of these questions, super valid. But how will we know? So again, this is a report that came in on the hotline, and we're asking, okay, maybe there's an opportunity here. Philip, one of the things that if we have access to the mom, we can ask, and if not, we may need to report the suspected concern. I'm glad you brought that up. A lot of people think that educational neglect is a mandated report. Educational neglect, meaning that they don't send their children to school, is not a mandated report. So one of the things about being a mandated reporter is to know what is reportable abuse and neglect and what isn't. And for a parent not sending their child to school, or that they've only been to school 67% of the time, and I don't know, 67% out of 100, okay, is this enough to make a suspected child abuse report? And you're right, sometimes we don't have access to the mom. Or the mom hasn't made, or mom or parent hasn't made themselves available. The absence of knowing is not abuse. The absence of not knowing means that we need to get some clarity. All right, here's another one. A 10-year-old minor resides with their father and siblings. The reporting party overheard the minor telling a peer that the father hit him. No further details and no marks of bruises reported. How can we get some clarity here? We do report, there is a consideration about reporting third-hand knowledge. However, we need to get enough information. So a question here is saying, can CPS be used to obtain clarity if we're not able to access the mom or the other family members? No. Child welfare and law enforcement are there to investigate. Now, if we're looking at this last question, this last one here about these children, and their mom didn't send them to school. Sometimes I know schools have gone to the home to check in on the kids and check in on the family. This would be a report if they've tried to make contact with the family, they've tried to engage with the family, and we're talking about impact here. We're still talking about impact because the only concern for this one right here is that they haven't gone to school. Not 67% of the time that they've been in school. Okay, so there's a question about, so to confirm, child abuse report cannot be completed for teachers or school staff. If a teacher is abusing staff, our only option is to report to law enforcement and not complete a report. I'm assuming that if it is a teacher, it is still part of a mandated reporting, not just to child welfare. Yes, that's correct. Law enforcement and child welfare both receive reports of suspected abuse. We both receive and we both investigate. Law enforcement investigates outside of the home in all of the cases, because child welfare, if there's an investigation that is outside of the home, child welfare will not investigate. We will evaluate it. Child welfare will evaluate it out and refer it to law enforcement. If there's a concern and we're not concerned about the parent or the guardian, then we're calling law enforcement to make a suspected child abuse report. You're still fulfilling your mandate, because fulfilling your mandate is either with law enforcement or child welfare. I hope that answers that. Okay, so a child residing with their father and siblings. Their child is 10 with their father and siblings. The reporting party overheard the minor telling a peer that the father hit them, and no other further details. So what could we do here? And no marks or bruises. So what could we do here to clarify versus reporting? We're maybe in an after-school program. Maybe we're doing a summer camp, and we hear a 10-year-old telling their friend that their father hit them. Is that enough for a report? We need to know impact. What are the impacts to the child? Is this injury likely to cause substantial harm to the child? We need more details. Check in with the child. Physical discipline, in and of itself, is not abuse. So when I hear about clarifying, not investigating, it is about how can we get to a point where we're not where we're not fearful to ask one more question, so we can make a determination, so that when we're looking at substantiation rates, and generally when we're talking about physical abuse or sexual abuse, a lot of these are more substantiated than general neglect. So we're really focusing on our biggest area or opportunity for growth is around assessing for general neglect. All right, so how do we figure this out? So if we're understanding that we need to clarify, we're not investigating, we know we need to reflect and get to know ourselves. We need to talk about the impact to the child, not the impact to us. Connect. When we're talking about the parents and families that we're working with, the father, the mother, the grandparents, all the other care providers who support us in raising our children, it's about connecting. We do have to get to know our community in so many ways in terms of resources, because if we're saying that making a report based on financial struggle is no longer a report, then we can't just as mandated reporters not do anything with that. We still have to find a way to support our families. So that does mean we need to get to know our community. We need to know what resources our families use. Whether we're working in schools or other organizations, we need to ask the people we work with, well, who do you go to for help? Who do you go to for support? So we're not offering people things that are not in alignment with what they feel comfortable. When I talk to people about working with community members, a lot of times they say, well, I feel judged. I feel like I'm getting a handout, or they're treating me like I should be happy that they're giving me this thing, that I should, and sometimes like that rubs people the wrong way. So how can we connect and develop relationships that focuses on strengthening families? Families really are the experts of how their houses are run. Families within the child welfare system or any other systems do not work well. We work well when we empower each other, when we help each other, when we say, okay, there is a connection here that I can help you make. Because then we would know why that mom only sends her children to school 67% of the time. There are other things that make reasonable suspicion, that's RS, things that make reasonable suspicion difficult. Insurance companies. Insurance companies make a reasonable suspicion very difficult. Why? Because they're saying, when in doubt, report. Anytime you feel, if you have those 3 things that we just covered, you make a report. You don't need to ask questions, just report. Well, why are our insurance companies so bent on making so many reports? Well, liability. Insurance companies, their goal of making these trainings, because a lot of organizations, the insurance companies give mandated reporter trainings because they focus on liability. So in every aspect, they say, make a report, or you'll lose your license. Make a report or you'll get sued. Because generally the insurance companies are the ones who have to pay for all of these things. Insurance companies do not have families' best interests in mind. Insurance companies, when they talk about mandated reporting responsibilities, they will focus on liability. They will not focus on the impact. They will not focus on your responsibility, and they will not advise you on how to connect still with your families before or after a report. Also, some conflicting guidance between supervisors and child welfare. You may be working within your organization and you're consulting with your colleagues, your supervisors, and y'all have worked hard and finally made a determination that yes, this is reasonable suspicion to make a report. And you call child welfare and they say this is not reportable, you shouldn't be calling. So that's also, it's like when you're getting this conflicting guidance between your supervisor and child welfare. That can also make reasonable suspicion difficult. So what do you do in those situations? Reasonable suspicion is an individual responsibility. So even though you have guidance from supervisors, you have guidance from child welfare, your colleagues, your clinical supervisor, volunteers, mentors may give you some support, some guidance. However, because it's an individual responsibility, you are required to make that call. So whether it's a supervisor or child welfare or some other administrator, you are responsible for determining reasonable suspicion and saying like, yes, I need to make a call or not. Consultations is another thing that makes reasonable suspicion difficult. Sometimes we consult with people who believe just like us, and so that may not provide us clarity. Or sometimes, as we were just talking, we come from a lot of different backgrounds and experiences, and those backgrounds and experiences come into play when we are providing consultations. And lack of trust. Lack of trust with our clients, with the system, with each other sometimes, can also make reasonable suspicion difficult. Some other things that I think that have come across that make reasonable suspicion difficult is what we've talked about, the differentiation between neglect and poverty. Neglect is willful. Neglect is willful, and it's likely to cause substantial harm to that child. When we're thinking about our general our neglect cases or worries that we've had in the past, how if we can sit and think about that now, how can we think about differentiating between neglect and poverty? How would you differentiate between neglect and poverty? I'm curious. Another thing we need to think about that makes it difficult for reasonable suspicion is the impact of homelessness on children. Being where we are in this place and time, poverty and homelessness impacts our children. But how? Is it willful neglect on the part of that parent? We also need to think about children with disabilities. children with disabilities are at a higher risk of abuse and with other in comparison to other children within their age category? So when we're thinking about gaze aversion, we need to also think about children who are not verbal or limited verbal skills. Always keep in mind that children with disabilities are at a higher risk of abuse and neglect. And again, they are being underreported. There's a question here, can there be neglect that isn't willful? For example, a parent incapacitated by substance abuse. That's a really good question. So, parental substance abuse in and of itself is not neglect. However, we do need to look at the impact of parental substance abuse has on a child. So if a parent is incapacitated by substance abuse, then we need to ask, well, what impact is it having on the child? Like if we're talking about a family who has a lot of resources, okay, if we're talking about a family who has a lot of resources and we have a parent who's incapacitated by substance abuse, guess what? They may have a nanny, they may have a babysitter. There may be families that may not be wealthy, but they may have a wealth of resources in terms of people. They have another partner in the home, adult in the home who is not incapacitated. They could have extended family members who are providing care for that child while the parent is under the influence of substances. Willful may be if that parent is is incapacitated, that child, and then so we have to talk about like the risk of that child. So what are some of the risk factors? Because depending on what the incapacitation looks like, depending on the age and developmental stage of that child, other family strengths, and other risk factors to determine, do we need to make a report? Neglect can neglect occur without intent? I don't know, Ruth, do you want to come off mute and say more?
Sure. So I'm just thinking perhaps of a situation where you have a very young child, infant or toddler, um, alone with a parent, no other potential caretakers in the picture. And because of the parent's substance use disorder, they sometimes can't be aware of their child's needs and therefore aren't meeting them. The child perhaps isn't getting fed for a very long time at a time. There may not even be food in the house, perhaps, and I would like to, in general, assume that it's not because the parent doesn't love and care for their child. And if they were not
Mm.
kind of in that situation because of their addiction disorder, that of course they would feed their child. They're not willfully neglecting their child because, they'd rather do something else,
Sure.
So that would be, it hasn't yet risen to the level of physical abuse or whatever, but the child, in my mind, is clearly getting neglected, but not by a willful intention of the parent.
Sure. Thank you for that, Ruth. And so I would be asking you, what is the impact of that having on the child? So we're also, and that's the thing with reasonable suspicion. It doesn't, when we look at the federal definition, it doesn't say, okay, here is the list of things to look at. Like, is it willful? What is the parent behavior? Is it negligent? Right? And what is the impact to the child and under what context? So we're really needing to, so that's why, so I really appreciate that, because I'm hearing the impact or the substantial risk of harm to that child. Like when I'm hearing that about the infant child and all of these things, I'm thinking about, okay, well, I can see what the substantial risk of harm would be to this child. And that's enough to make a report. So thank you, Ruth. And so Michelle is saying, a parent with cancer who lost custody of her child due to going through chemotherapy. So what is the difference with that and someone who shoots up? So, I don't know if there would be a difference. I could see the similarities being, maybe that's how I can speak on that. I can see the similarities being that a parent is incapacitated and the parent didn't make arrangements for someone else to care for their child. So both of those situations, if they both parent loses with cancer because of going through chemo, and someone shoots up, like the thing that I see similarly is that the parent is what they call incapacitated and or absent. One was given a pass and the other didn't lose custody. Can you, Michelle, can you say more? Yeah, I'm not really understanding. And it sounds like it sounds like it's a good point. Okay, so, all right, so it says, but you can reason with someone who's undergoing treatment to find them help. A person who is under the influence of drugs may not be willing or able to reason. Uh-huh. Yeah. But a second person who was using also couldn't care for their children, was able to retain custody. So there are, when we're talking about decisions after, like once we get into child welfare, is I kind of want to stay on topic in terms of what mandated reporters, what can we do at this level before it gets to child welfare? Because dealing with child welfare after, and the third part of the series is, I think on May 1st, talks about like what happens after a report has been made. So I will be taking this information in, and we need to look at like all aspects of it as mandated reporters, like what we do right now in terms of who we call to the hotline is really what today's topic is on. It's like, how can we have an understanding of how can we support families before we make a report and before child welfare intervenes? Because child welfare, that's a whole nother beast. And right now we're really focusing on as mandated reporters, what can we do to support families that have substance abuse issues? How can we support families that have health issues? One of the things that came up as I continue, one of the things that have come up is cultural practices. A lot of people have asked over and over again in terms of abuse or neglect, is this cultural? Is this cultural? So a couple of things. Everything is cultural. Everything that we do is cultural. We have family culture. We have race. Yes, we have ethnic cultures. We have geographic cultures. Like the things that happen in only specific areas. Like there's cultures with generational cultures. So everything that we do is cultural. So when people ask, is it cultural? Yes, it's cultural. And cultural practice, right, living is cultural, right? Cultural practices do not equal child abuse. Cultural practices do not equal child abuse. There are a lot of us may have come from newcomer families. We work with newcomer families in relation and community with newcomer families. So how do we interact in a way that is uplifting, empowering, and engaging? One of the things that we can do is support, one way of supporting newcomer families is to provide education of like our local laws. Be curious. A lot of times we may think we know, but we don't know, because if everything is cultural, if there's family culture, and that changes and shifts with all families and within families, then one way to understand people is to be curious. Assume positive intent, assume that they, like we were saying, that, you know, parents want to, as Ruth was saying, parents want to provide care for their children. They love their children. People are not generally abusing their children 24 hours a day, 7 days a week. And sometimes they do not have local support. Sometimes they don't know where to go, or their community, they come here and their new community is so small that they may not feel comfortable or able to go outside of their community. So it is our jobs to learn to engage and continue to engage with families. A lot of the calls that we receive that are received, excuse me, a lot of the calls that are received on the hotline when it comes about newcomer families or culture, a lot of it has to do with resources and lack of resources. And yeah, there is a lack of trust because maybe we don't give them reasons to trust. There have been some, these questions are really good, thank you. As there have been some federal pushes to make changes to these laws. The federal government passed something called the Family First Prevention Services Act, or the FFPSA, in 2018. Federal government really has started to notice child welfare and notice that too many children are in child welfare, too many families are impacted by child welfare, and they're impacted because of their financial situation. So what did the federal government do? Well, they said, you know what, we're going to, instead of giving money to organizations or child welfare organizations for how many kids they have in care, which has been historically how child welfare has been paid. So it's like you get paid to remove children. Well, federal legislation said, no, we're going to stop that. And in 2018, they passed this legislation where basically they are, instead of pouring money into intervention, they are giving money to states, offering money to states for prevention efforts. Okay, here's where we all fit in. So California, so they said, federal government said, hey, if y'all want this money, you can have it, but you have to develop a prevention plan. So in 2021, I believe, California created their prevention plan, statewide prevention plan. You can look it up. There are resources available for you to see this. And within this state prevention plan, they said, okay, counties, if you want this federal money that we're receiving from Washington, then you have to develop a county prevention plan. So guess what? Every county in California, 58 counties across the state applied for and completed a county prevention plan. One was created right here in Alameda County that was approved back in last summer. This county prevention plan provides local efforts to fund some of these new law changes. So what does it do? It provides it's required to provide financial supports to families. So that means that there is money that is coming down through county funding to provide direct funding, direct money to families that are living in poverty, families that are struggling, families that have higher risk factors. There's one pot of money called Bringing Families Home. And what that is doing, it's through Alameda County Social Services. And what's that's doing, I remember I told you how children who are former foster youth are at higher risk for child welfare involvement in the future. Well, and there's something in the chat talking about fathers. Well, Bringing Families Home specifically is providing housing resources, housing funding to fathers who are former foster youth in Alameda County. So we're going directly to like who needs it the most. So we're providing financial resources to fathers. There are other contracts that are in the works right now for families who receive case management services to also receive financial funding. We're working on something called community resource guides. We have been saying, mandated reporters have been saying, we need help in determining reasonable suspicion. Just how child welfare has a structured decision-making tool to determine if a child is safe or not, if the risk factor is high, low, or very high. Mandated reporters will soon, across the state, right now it's being, there's one in Humboldt County that is saying that, okay, we'll give mandated reporters a community resource guide to help them make structured decision-making on whether or not a report needs to be made. It's coming. And this is, of course, this change in mindset from mandated reporting to community supporting. Well, this is where we're all here. Like, just remember, think about all the reasons why we started this work. We did not start this work so that we could make reports to child welfare. We started this work so we can support children, support families, support our communities. So we also have to have a change in mindset that neglect is not poverty, that poverty is not neglect, that all children deserve to be at home, safe, and healthy. There are also, within these slides, you can see other prevention efforts that are going on in the country or in the state. So, under-resourced families receive more reports than families with resources. Small, direct investments to families reduce neglect. So today we've covered what the updated reporting laws are, the role of a community supporter is about how to engage and connect families to resources, and how we can use these local communities, pathways of support to provide families with connections to the resources that they need. I gave this little picture in the slide at the end because a lot of times, I know the weather is getting nicer, so we're not thinking about jackets right now, but a lot of times some children may be out there and they may not have coats and they may not have jackets. And we say that neglect, quote unquote, is visible, but it's really poverty that is visible. But sometimes it could be as simple as, my kid doesn't want to wear that coat right now. How can we ask one more question to clarify versus investigate? And with that, I thank you. Does
Thank you,
anyone?
Colette. We just want to open up the floor to questions
Yes, if there's
and
any
comments.
more questions or comments, we definitely have a couple of minutes to hear that now.
I just want to say thank you so much. I've been sending private chats to Leah like, oh my God, this is incredible. I think this angle is much needed. So I'm so grateful that this angle is happening. It's interesting because, I mean, ultimately to me, what we're up against is the same thing as racism, right? Like we could have trainings, right, on, you know, trying to make folks not racist, but it's an individual path and it's cultural and so many other things. But it definitely begins with conversations like this. And I guess for me, I just feel like I need to throw this out there, which is the question to ask is, let me ask this question of you, Colette. Has there been any research done on the effects of children being yanked out of their homes and what happens as a consequence? Like, has there been any kind of follow through systems and what ends up at the end result?
Yes, there has. And we'll be talking about that in the third series. And it has very negative effects. It is a traumatizing experience for children to be removed from their homes and placed into foster care. And then once you get into foster care, then there may be with strangers, they may be with hopefully a non-custodial parent or family, but if they're with, strangers, then they have to get acclimated to that. A lot of times they're removed from their communities. There are so many supportive services that could happen prior to that. Once families are involved in child welfare, it's very difficult to maneuver within it and to get out of it. So the work that I'm doing and what we're talking about today is how can we support families before child welfare involvement? How can we not re-traumatize children who may be abused or may be getting neglected from parents who need supportive services, families who need connection, parents who need someone to talk to, a stress reliever, respite. So thank you for that. Let's see, I see some more questions. If the court established some restrictions and the parent is not following it as mandated reporters, what is our position? Or is it something that the other parent needs to take into court? Emily, that's a good question. We are not, mandated reporters are not, we're not court representatives. So unless we're filing a suspected child abuse report, then we're doing that, but not for a parent failing to follow court orders. Another question is, yes, no, I do like the emphasis on clarification versus investigation. We need to be very clear about that. There are no government programs which provide car seats to families. Actually, Jeanette, I'm gonna there are organizations. I'm gonna actually give you an email address. Because the Child Abuse Prevention Council should be able to refer you to someone for that. And so, yeah, any other questions, comments? Jeanette, a lot of public health organizations provide car seats and hospitals provide car seats. Yeah, public health generally has car seat programs. We have a big room today, so I'm glad a lot of people are kind of helping out with that too.
Thank you for mentioning that R&Rs do as well.
Mhm.
Thank you. And
Yes.
private charities, R&R resource and referral agencies.
Yes, thank you, everybody. Thank you all so much today. I really appreciate. So, Catherine.
Yeah, I just want to thank you, Colette. Such a wonderful kickoff to our series. And just want to thank you. And we're really excited to have you back. And this is a new pilot for us. So we're really excited how the community's been engaged and all these questions. We're looking forward to our second and a third session. And for those of you guys who attended our session, thank you for joining us today. We really appreciate all the engagement, questions, and we will look forward to seeing you guys soon in our next upcoming sessions. Thank you and have a nice day.
Thank you.